having a heart attack, would you know it? The signs and symptoms can be different for men, women, elderly, all kinds of people in our population. That's why I'm at Johnston Medical Center in Smithfield talking with Kenny Gooch, the chest pain coordinator. Let's talk about the differences that men, women, the elderly can see when they're having the symptoms of a heart attack. Absolutely. Our male population is more of the classic chest pain, radiating into the left arm, nausea, the extreme diaphoresis. Our women population actually presents more often with shortness of breath, weakness, and dizziness. It's been our experience with the elderly that they have more even vague symptoms where they just come in, they just don't feel well, or they may be having some nausea and some vomiting. So if someone is having any of those symptoms, should they call 911 right away, or can they assess, am I really having a heart attack? Generally, if they're having symptoms longer than 10 minutes, they need to be seen by a medical provider. The harm would be most of the damage that occurs during a heart attack occurs within the first 2 hours. Really? So we want them to be evaluated in the first 2 hours, and definitely want them to call 911. The program that we want to do is survive, do not drive. So we have times where people don't make it. Okay. Can you describe what it looks like when someone comes here to Johnston Medical Center, what the process they'll go through if they're having some of those symptoms? Absolutely. In our emergency room, when they present to the emergency room, they are greeted by a nurse. They're not greeted by registration. We have a nurse who immediately ascertains what their complaint is, and they make an early decision whether or not this patient needs an EKG. They're immediately taken to an area, and an EKG is performed and shown to our physician within 10 minutes. That's the first step. If that EKG shows that they're having a heart attack, we immediately go into a transfer process where we would transfer them to the closest cath lab. If their EKG is normal, then the next step is we start looking at their blood work to see if they're having a heart attack or not. So you can tell from blood if someone's having a heart attack? Within the first 6 hours of the onset of symptoms, they do have a blood test that will show whether or not they're starting to have a heart attack or not. Okay. What about the stress test when they run on the treadmill? When do you do that? Typically, if the EKG is negative and the blood work is negative, but there's high suspicion that they may be experiencing some type of acute coronary event, they're generally admitted either as an OBS or an inpatient status, and then we do the stress test to make 100% sure that they're not having cardiac problems. Is this generally something that you see in people who are older in age? Because I know, for example, me, when I was younger, the first time I felt heartburn, I thought I was having a heart attack. But I was in my 20s, so everybody around me said, there's no way you could be having a heart attack. We have had heart attack patients come in their mid-30s. Really? So we start doing our screening at age 30. Wow. Thank you so much, Kenny. Insightful information. You can learn more by going on the web to johnstonhealth.org.